This is Laura and Theresa with another episode of Ask Me Anything. This week's topic is words that matter. As a leadership trainer and team culture developer, communication is everything. Theresa, I know you've had some frustrations regarding specific words or phrases used in the dental office. Will you elaborate on some of those with our audience?
Yes. Well, one of my very intense pet peeves, if you will, is the phrase deep cleaning. In dentistry, we tend to, I think, marginalize sometimes patients' condition, either because the patient doesn't understand what we're telling them, or we feel that we need to make it easier on the patient to understand what we're telling them, when in fact, we're really not explaining to them the true nature of what's going on. Mm-hmm. And so deep cleaning is probably one of my biggest pet peeves when it comes to
what is the word they should be using? Is it in-depth education, or is there something? What is your preference?
Well, I think the best thing to do is explain the patient's condition, and it's not that we do tell patients what's going on. Mm-hmm. But there's a difference between telling a patient and really educating a patient. So when we talk about deep cleanings, we're actually talking about periodontal treatment. And periodontal disease is a disease, but we kind of forget that, I think, in dentistry, and we don't really enforce that and emphasize that to a patient, especially a patient that has diabetes, cardiac disease, other comorbidities that are exacerbated by periodontal disease.
Yeah,
and so
Go ahead.
Oh, I was just going to say, so what happens is, even though we're explaining it and we're telling them, we're still kind of letting patients dictate treatment a little bit. And we're explaining it like a deep cleaning is kind of like an upgrade from your free cleaning. And patients don't want to pay for that because cleanings are free. Why do they want to pay for, leather seats when it comes with seats, a certain kind of vinyl seat or whatever? It's like an optional upgrade to a patient's, and it's not.
Right. Their thinking is that it is. The other part of that I like is that you may feel like you're educating them, right? Like you said, some do a really great job of explaining what's going on, but then they almost kind of diminish it by connecting it or using those words, deep cleaning. What's another example of a word you just hate?
Oh gosh, there are a few. One thing that I don't like to see, I see a lot of it when I do my snapshots and in documentation and explaining to a patient, I'll hear the word chip. Oh, there's a slight chip in your tooth, or the filling is chipped, or the tooth is chipped. When in fact, in many cases, you might have a whole mesiolingual cusp that's missing. That's not a chip. Let's call it a fracture. If that's the case, if it is a chip, then let's call it a chip. But when you've got a cusp missing, that's not a chip. That's a fracture. You've got missing cusp. We just basically need to use the words that accurately describe the situation that we're seeing. If there's blood, call it hemo. Don't just say, slight red stuff. I've seen that documented too. It's like, it's slight red stuff. It's blood. Okay, let's call it that. Let's tell the patient, you're bleeding. Your tissue is bleeding. Things like that. We've got chips, we've got little things like that. We need to call it what it is.
Call it what it is. So one of your favorites, I know I've heard you say, is that it's just. Tell us all about just.
Well, several years ago, I wrote an article called "It Just Is Just a Word." And the reason that I did that, I kind of got inspired to do that, is because I'm going into offices and I'm listening to, receptionists, for example, talk to people on the phone, or I'm listening to somebody explain, what's going on with treatment. And I had one receptionist one time deal with a patient that was calling at the last minute to cancel their hygiene appointment. And, they said, that's okay. It's just your cleaning. And that really struck me. It's like, it's just your cleaning, so it's not important. You've just let the patient know it's okay if you short notice cancel because it's just not important. It's not my time, it's not your time, but we're treating you somehow.
Yeah,
so
adding that word is a complete minimization of everything you say after it.
Exactly. And I've heard doctors say, oh, we can do that with just a filling. Just a filling. You know, we fill potholes, but we restore teeth. So, you know, we're going to restore your tooth, whether it's from a chip or, you know, the whole cusp is fractured. We're restoring your tooth. We're not filling potholes.
Those are really great examples.
Yeah, words do matter. They definitely do matter.
So communication's hard. How do you recommend that these practices that are looking to fine tune their phrasing, how do they go about doing that? Where do you start?
Well, I think the first place to start is by listening to what you're saying. Sometimes we don't hear ourselves, but you know, we may have an assistant that might hear a front team member, or a front team member might hear an assistant say something, or a hygienist say something, or the doctor say something. So I like to challenge people and kind of make it a little bit of a game sometimes, is to, let's see at the end of a week who writes down however many words or phrases that we can change that sound a little funny. We're not pointing out necessarily who said that, but we're just writing it down. And the person that can come up with the most phrases, you know, might win a Starbucks card or something like that. And then we're going to work on our verbiage. We're going to really get that dialed in to say what we mean what we say, and stop letting patients kind of, you know, drive the bus.
I love that. That is a great idea. Just the awareness alone, you'll be surprised what an impact you can make just by making them think about it. And have an idea board, or you can, you know, people aren't being put on the spot, but they can write it down on a little Post-it note, put it on the idea board, and it just brings the next level of awareness. I love that.
Yeah. Just by getting rid of the word just is going to make a big difference.
A huge difference. So email or DM us to get answers to your big questions in your dental practice.